right, well, welcome everyone to the third Kentucky Nurses Association Town Halls. This is covering our River City area, the Louisville metro area, so we thank you all very much for being with us today. Representing KNA, we have myself as president, Delano Manson, who is our CEO, executive director. We have Brittany Welch, who is our governmental affairs cabinet chair. And we have Kim Becker, I think, hiding in the background and running sort of some of our audio and our Zoom and all that. And then Katie Bradshaw, who is our River City chapter chair. So thanks again for being with us tonight and taking time out of your very busy schedule. Just a little bit about Kentucky Nurses Association. This organization was established in 1906 as the organization to establish the nursing profession, scope of practice, and standardized education for nurses. By statute, the KNA represents and speaks for 89,000 voting Kentucky nurses who make up more than half of the healthcare workforce. KNA is comprised of three different organizations: Kentucky Nurses Association, Kentucky Nurses Foundation, which is our not-for-profit arm, and KNAC, the Kentucky Nurses Action Coalition, which focuses on workforce issues and some other very pertinent topics to nurses in Kentucky. KNA focuses on the profession as a whole, therefore. KNF focuses on the education, research, and scholarship aspects. And then KNAC focuses on workforce, including sustainability and meeting healthcare needs. KNA is responsible for promoting and protecting the professional image of nursing in Kentucky. While the history of the Kentucky nursing profession stands on the shoulders of KNA, there are many, many activities that we have that we support on an ongoing basis. One is legislation that supports nursing, nurses, and access to health care. Another is that we appoint nurses to the Nursing Technical Advisory Committee, the TAC, which is part of the MAC, the Medicaid Advisory Committee. KNA provides recommendations to the governor for appointments for the 6 seats on the Kentucky Board of Nursing. And just a little inside thing for you all, sometimes people confuse KNA and KBN. So we are a professional organization, Kentucky Nurses Association. KBN is obviously the Kentucky Board of Nursing, part of the government, and is there to provide licensure, protect the public, that kind of thing. We convene and collaborate with a bold group of health-related organizational affiliates to address healthcare and nursing issues. We provide continuing education for nurses that they use for their licensure requirements, as well as for general professional development. KNA has input and impact on nursing school curriculum development. We have an active political action committee. We participate in workforce analysis and development. And we are committed to social justice and the impact of JEDI, which is Justice, Equity, Diversity, and Inclusion on healthcare outcomes as outlined in our mission, vision, and values. We recently participated with health departments throughout the state to deliver 140,000 COVID vaccinations, over 12,000 COVID tests, and over 100 community listening and education sessions about the pandemic. As well as responding to the tornado disaster in Western Kentucky, we also are currently responding to the flooding in Eastern Kentucky, working directly with KNA members in that part of the state. So this is a partial list. There's many, many other things that we're involved in that we do. Want to keep it as brief as possible. So now we will kind of focus on our legislative opportunities, and I will hand the microphone over to Dr. Brittany Welch.
Wait.
Oh. All right.
I want to mention that we are recording this, and we will put this Zoom recording on the KNA YouTube channel. We have to edit it and get out all my ums, but as soon as we do that, we'll get it up. It'll take about 5 days. Also, I'm going to ask each of you to limit your responses to 1.5 minutes, 1.5 minutes, and that includes your intro and for all of your answers. Now, the good thing about that is I am the timekeeper, and I have a hook, and it's called the mute button. So while we want to hear all of the things that you have to say, we want to make sure that everybody has an opportunity to share with us their views and their opinions. For the rest of the evening, as President Metter mentioned, Brittany is going to be reviewing the KNA 2022 priorities, and then we'll have Q&A that will be led by our lobbyist, Julie Denton, and Dr. Brittany Welch. And then at the end, we'll take questions. The attendees and the attendees, you may put your questions and comments in the Q&A chat area. So with that, I'm going to ask each of you to use 1.5 minutes to tell us a little bit about who you are and what you stand for. And I have my timer and my mute button ready to go. So why don't we start with, let's see, up at the top left for me, Matthew Deneen. Did I say that correctly?
You did. That is
Okay,
correct.
good. All right, I'm going to turn on my timer. You got 1.5 minutes to tell us all about you.
All right. I probably won't need that long. My name is Matthew Deneen. I am a retired educator, and I am running unopposed for the Senate seat for the 10th District, which includes all of Hardin County and a small portion of Southern Jefferson County. I have served 2 terms on the Elizabethtown City Council here. I'm very proud of that service. I also work with a lot of nonprofits here in Elizabethtown, and I have helped raise almost $750,000 without raising any taxes for community improvement projects throughout Elizabethtown and Hardin County. My family's been here for 42 years. And I'm happily married and have 2 daughters, one in college still, and one is married now, and both live in Lexington. I'm looking forward to getting started in January, and I'm still out campaigning, trying to earn a vote, even though I'm running unopposed.
Thank you very much. Next, Julie, I'm going to let you introduce yourself too, and then I'll get back to you as you're being the moderator.
Sure. I'm Julie Denton. I'm the external lobbyist for the KNA. I served in the Senate, as some of you know, for 20 years. 16 of those years, I was chair of the Health and Welfare Committee. So I've worked with KNA for a long time, and I'm honored to be working with them now.
Thank you. All right, Jared Bauman.
Hello, my name is Jared Bauman, and I'm the Republican candidate for State House in District 28. That's the southwest portion of Jefferson County and the city of Louisville. And it's certainly an absolute pleasure to be here with the Nursing Association tonight. I thank you very much for the invitation and for the incredibly heroic service that you provide our state and our communities around the Commonwealth, especially over the last couple of years. I know it's been very difficult at times, and you guys have shown the highest levels of integrity and resilience through this time, and I thank you for it. I'm running because I want to drive improvements in Southwest Louisville, the place where I was born and raised. I'm also a husband and father, but I'm on a mission to make Kentucky the greatest state in our nation. And I think that the health and well-being of our people is going to be fundamental to achieving that. So I certainly support the highest level of health care for the people of the state of Kentucky. And I certainly understand that nurses are the heartbeat of a strong healthcare system. So I look forward to learning from all of you here tonight on the panel and from the other candidates. And thank you again for the heroic service you provide our community out there on the front lines every day. And ensuring the health and well-being of all Kentuckians.
Oh, you did it. You had 2 seconds to spare. Okay, Charles Breitenbach. Did I say that right?
Charles Breitenbach.
Breitenbach, okay.
I am the Republican candidate for House District 38. The 38th district runs from roughly from Iroquois Park area into Valley Station. I'm a lifelong resident of my district, so that was definitely one of the main factors in my decision to run for this position. It's a community I've lived in literally my whole life. I'm married to my wife, Marcia. I have 2 children, Nicole and Kyle. Nicole lives up in Northern Kentucky, and my son, Kyle, lives here in town and works for UPS. But I appreciate the opportunity that y'all are giving me this evening to meet all of y'all. I'm very interested in learning more about your association, as I know plenty of nurses out there. So I hear a lot of the woes and the issues that you all have to go through on a day-to-day basis. And again, I'm appreciative of the opportunity to learn more about your association.
Thank you. All right, Jenny Mulvey Wooldridge. I'm tearing up these names today. I hope you guys noticed that.
You did great. Yeah, I'm Jenny Mulvey Woolridge. I am the Republican candidate for the House of Representatives, District 46 in Louisville. That's the Highview, Okolona area, part of Fern Creek. I do appreciate you welcoming each of us to be with you today with the Nurses Association. I am a working mom. I am a wife of a retired law enforcement officer with LMPD. He's now with the Sheriff Department, and a mom of 2 teenagers. So I believe it's important for us to have a safe and healthy place to live, to work, and go to school. So that's driving factors of why I'm running. I know that nurses, as well as, law enforcement officers, have been that quiet, unthankful people that have been those driving forces behind what we do every day. You all are the ones that are the thankless jobs, the ones that are out there every day, the ones that giving your lives, and the ones that work on holidays and are just out there every single day. So on our behalf and everybody's behalf, thank you for that. But I want to be the ones that are out here saying thank you for the ones that don't. But I want to be here to support that. Want to be the ones to make sure that we are here to say that. But again, want to be out there making sure everybody does have that safe place to go and live. But why I'm here.
Thank you, Jenny.
Thank you.
Dr. Welch, would you like to introduce yourself?
Yeah, so I'm Dr. Welch. I am the Governmental Affairs Cabinet Chair and on the Board of Directors for the Kentucky Nurses Association.
Thank you. Ken Fleming, would you like to introduce yourself?
Yes, thank you very much. I appreciate the opportunity to talk to the Nurses Association, and I think other people have mentioned that it's very important to support you all as a profession, to making sure that health services are delivered in a prudent manner. I represent the 48th district, which stretches from basically Indian Hills out to Prospect, anything north of Brownsboro Road up to the river, and also go into Oldham County as well. I'm seeking my 3rd term. I've been a Metro Council member, for about 12 years. I got quite a few years of finance background. I've run my aerial survey and mapping company, and now I'm involved in the past 7 years to provide mental health services. So, and I'll put a plug in here, and that is if there's a psychiatric NP that's looking for a job, I would like to hire them on. Because we are in desperate need to have an NP on staff or even part-time to help out and so forth. So in any case, I have partnered with you all on many occasions, from House Bill 354 to reciprocal agreement with which is House Joint Resolution 5. A pretty big one, Senate Bill 10 that helped push through on the House side, and then House Bill 573. So anyway, I look forward to working with y'all, and I really appreciate what y'all do to this community.
Thank you. Okay, Maria, you want to unmute yourself?
Hi, my name is Maria Sorolis. Thank you for the opportunity to be here today. I am a mom of 3 now adult children. Everybody is off the payroll. And I'm a lawyer in private practice. I've also taught in our middle schools here in Kentucky. I'm running for the 48th district, which is a district I've represented for 1 term a couple years ago. I am very interested in the needs of our nurses and alternative healthcare providers because we have such a shortage of physicians in our rural areas that we need to really empower other medical providers to provide the services that are so lacking. And as a consequence of that, we really need to make sure that nurses get the independence and the respect that they so deserve. I look forward to your questions and learning more about your organization. Thank you very much.
Thank you. Jason? Hi.
Hey, how are you?
I'm doing well. Speak to us.
I've noticed you didn't try to announce my last name because it's
Well,
not
I
exactly
know what it is. It's Nemus, and it's because we've talked
got it.
before.
We have. Thank you. So I'm Jason Nemus. I'm running for House District 33. I've represented the 33rd district for 6 years now. it's Eastern Jefferson County. The heart of it is Middletown. It also has Anchorage, Linden, and it goes into Oldham County, where I'm sitting now, across from a cornfield. I'm not driving, by the way. I'm in the car, but not driving. And it also has some of Shelby County in the district as well. I'm running for the same reason I ran initially 6 years ago when I took on a Republican incumbent of 20 years. And that is that I want to improve the lives of Kentuckians, most especially to bring economic development, because I think so many of our problems are solved by more jobs and more taxpayers paying into the system, so we can have strong support systems for those who are the most in need. I'm also in charge of recruiting for the House caucus, and I'm very proud that a number of the people that I've recruited from Louisville are on the phone call here tonight, because I think it's extremely important that we have as many people as possible in the majority caucus room where decisions are actually made from Louisville. And so very proud that the group that's with me tonight is here. A bunch of excellent people who will improve the lives of all Kentuckians, but make sure that Louisville's voice is heard more profoundly than it's been heard in the history of the General Assembly. So my mother,
And your time is up. All right. Sarah Stalker, would you speak to us?
Hey, yeah, thank you so much for the invitation. I appreciate it. And thank you to all of the nurses for everything that you do every day before the pandemic, certainly during the pandemic, and the fact that we're still in the pandemic, and we have not let up. Sometimes I think people still forget, but I am Sarah Stalker. I'm the candidate-elect for the 34th district here in Jefferson County. That is everything Parkside of Bardstown Road, the St. Matthews, St. Regis Park, a couple of neighborhoods over in Hikes Point, Crescent Hill got drawn in, and Windy Hills right off Brownsboro Road. So that is that new district. I was raised by a nurse, so the conversations and the struggles and the challenges is something that was frequently talked about in my household growing up, and have several other family members and friends that are in the profession. My background is in the nonprofit sector, and I'm also pretty well versed about so many of the organizations that work directly in healthcare, whether that's physical needs, mental needs, and then all the other types of organizations that work where mental health and physical health are certainly impacted. I have been a foster parent with the state of Kentucky for about 7 years. And that was a really eye-opening experience when it comes to all of the needs for our kids. Kentucky is unfortunately leading the nation when it comes to child abuse, and that's for the third year in a row. So, there's a huge focus for me about started on the right path, just from day one, and getting them through.
Sarah. Your
Thanks.
time is up. Thank you.
So I want to start by thanking everyone for attending and coming out to support nursing and really to become informed, and when we head to the polls in November. So I'd like to start just by talking about KNA and our legislative focus. So it's important to kind of set the stage, as KNA members can be found in every legislative district throughout the state. Every year, the Kentucky Nurses Association works to establish legislative priorities that represent the interests of our key stakeholders. That's both nurses and the communities we serve. Our membership is comprised of leaders in emergency, oncology, critical care nursing, nursing education, business, administration, primary care, school nursing, community health, and so much more. In previous legislative sessions, we've supported placing a school nurse in every school all day, every day. Just as nurses believe in evidence-based practice, we also believe in research-based policy implementation. We believe the research that suggests placing a school nurse in every school will decrease misutilization of emergency departments and improve pediatric chronic disease management. We believe schools with school nurses have higher standardized testing scores and lower dropout and truancy rates. We believe this because strong research suggests it. Although any of these factors on their own would be an excellent reason for KNA and legislators to support school nurses, we also believe in the research that suggests for every $1 spent on school nursing, yields an overall cost savings of $2.20. To kind of put that into perspective, it's as though we would be buying something amazing for $1, handing the cashier a $1 bill and receiving $1.20 in change, and still be able to keep that something amazing. In previous legislative sessions, the Kentucky Nurses Association supported increasing patient access to care through the restructuring of the CAPA CS requirement for those who qualified. To put this into perspective of why this is so important to nurses and the communities we serve, if I were to show you a map of the state of Kentucky and color all the areas of the state black that were designated mental health provider shortage areas, the entire map of Kentucky would be black. If I were to show you the same map of Kentucky with all the districts blacked out in which we have a primary care provider shortage area, around 84% of the state would be black. Restructuring the CAPA CS requirements, it's not a title or a licensure issue, it's an access issue. It's a patient outcome issue. Data supports the safe utilization of NPs to fill the gap in our healthcare system. NP outcome data is not only at least equivalent in the primary care setting, research also suggests it's less costly. Kentuckians need access to improve health outcomes. Restructuring of the CAPA CS can assist with improving access to care. We've established that access to appropriate care is a priority for nurses throughout Kentucky. It has also been discussed that we believe in research-based policy solutions in order to increase access. Sexual assault nurse examiners provide essential care to victims during the most vulnerable time in their life. Research suggests that when a victim has access to a sexual assault nurse examiner, there is not only improved patient outcomes, but significantly improved prosecution rates as well. Improved mental health outcomes translates into long-term cost savings. Increasing access to SANE nurses through incentive programs to ensure hospitals are able to provide SANE nurse training programs can assist in providing Kentuckians with the access they so desperately need. In 2020, the Kentucky Nurses Association also supported COVID mitigation efforts. At a time of uncertainty, devastation, and the loss of so many, Kentucky nurses provided support for so many. We supported vaccination efforts, masking, workforce support. Although controversial to some, KNA is always guided by data and by what is ethically just. KNA did not just support these measures in theory. We provided boots on the ground support to thousands of Kentuckians during the most trying time in US and Kentucky history by testing and vaccinating thousands of Kentuckians and by supporting our affiliate organizations who provided surge support to the most underserved areas of Kentucky. This is why nurses are the most trusted profession in the world. Through the most difficult times in Kentucky history, nurses have rose to the occasion and have served in our communities, in our hospitals, and in our homes. But nursing is at the point of a critical crisis. Although there are 89,000 nurses in the state of Kentucky, we have an estimated shortfall of around 36%. Could you imagine walking into a hospital and only 2/3 of it being available and staffed? Consider the implications of that. Consider the patients that will not obtain the necessary care. Think of how that impacts patient outcomes and therefore healthcare costs. Kentucky Nurses Association support initiatives to correct the nursing crisis. We supported initiatives such as faculty retention and recruitment initiatives, expanded loan forgiveness opportunities, a nurse emeritus program, retention programs, and creative solutions in order to attract and retain nurses to the profession. Kentuckians deserve nurses. As previously discussed, these were our 2022 legislative priorities. Each year, the Kentucky KNA Governmental Affairs Cabinet receives requests for support and opposition for various topics or legislative issues. These are obtained, they are researched, and great consideration is made on the impact to KNA's priority stakeholders, patients, and nurses. The Board of Directors then determines KNA's position on the topic based on the evidence provided. KNA values the input of every nurse, every patient, and legislator throughout Kentucky. If you wish to have a topic or bill considered by the KNA, you can simply navigate to KNA's website, click on advocacy, and then on request to support an issue or legislation. And with that, I'm going to go ahead and turn it over to Ms. Denton, who's going to start with our questions.
Thank you so much, Dr. Welch. And I know that some of you have to leave, and I know Mr. Deneen has to leave in like 2 minutes. So I'm going to real quick ask you, how do you plan to support nurses in the 2023 session?
Well, here in Elizabethtown, I've worked with ECTC's President, Dr. Pate, and the nursing program, and I'm glad to see that they have an enrollment of about 40 new nurses in their nursing program. And I think that workforce development and expanding our nursing programs is very critical to moving Kentucky forward for healthcare reasons. I do agree, as a former principal and a teacher on all K through 12 levels, that school nurses are vital to our student population, and I do support that effort. I'm glad that was mentioned earlier. My wife is seeing a nurse practitioner, and I understand the difficulty of getting in to see doctors and the shortage of doctors in some areas. Our nurse practitioners are really a critical piece of the puzzle in serving Kentuckians. So I do look forward to supporting those efforts and hearing more ways that we can better serve Kentuckians.
Thank you very much, and we appreciate you being with us.
Thank you for having me, and I do apologize for having to leave, but I do have another meeting, and I look forward to coming back and where I can take some more questions, and I will return to your next meeting.
Thank you.
All right, thank you, Julie. Good to see you again.
You too. Bye-bye.
Nice to meet all of you.
Jason, I know you've got to hop off at 7, so let's go ahead and get your answer to the question, how do you plan to support nurses in the 2023 session?
Thanks, Julie. I plan to do it the same way I've done it the last 6 years. I'm co-sponsoring the Capo CS bill that passed the House last year, and I've been working on a few senators to make sure they support it. Some in my own, I don't know if there's in my household, but some in my own family to make sure that he supports it, and I'm glad that he does now. And so Capo CS, I think, is the big one. I want to say I represent doctors with the Kentucky Board of Medical Licensure, and I represent nurses for the Kentucky Board of Nursing. So I can, in a kind of unique way, stand up for nurses on this aspect, as I have done in caucus and on the House floor, and say that the Kentucky Board of Nursing actually takes these issues much more seriously than KBML does. I'm not saying they don't take it seriously. They used to not. They do better now. But KBN, you guys actually regulate your profession much better and much tighter than the docs do. That's just a fact. And so I share that with my colleagues. I think that to push back against the notion that, you let nurses have this authority, then all of a sudden, everybody's getting opioid prescriptions and so forth. But anyway, so that's the main thing. I also have a birthing center bill I know that I've worked with a number of nurses on that you guys support. I'm very thankful for that and happy to move that. But also say things I should have led it with this on my introduction, and that is that I'm the brother of a nurse and the son of a nurse. And Kim Evans, who everybody knows is one of my neighbors, and she and I have become close, and she makes sure I know all the issues that I need to know. So I'm going to do the same thing that I've done before in supporting nurses. It's nothing new. I'm going to make sure that I'm there for you when you need me in the caucus room, where, as I said before, where decisions are made.
Thank you. We appreciate that. Sarah Stalker.
So the first and foremost easiest thing to do to support you all is to recognize that you are the experts. So that seems to be a challenge sometimes for some of our folks in Frankfort. You're making decisions and passing legislation that is affecting people's lives, and sometimes there is no proximity or a complete disconnect from the issue at hand. So recognizing and making sure that the relationship there is strong, and really hearing firsthand from you all what the needs are and being able to support that. And not even just waiting for you to come to me to say, hey, this is what we want to do. I try to be extremely proactive in my relationships with folks, and specifically trying to find things within the community where the need is there. And I think a lot of that just comes from my nonprofit background. So recognizing that you're the experts in championing these things. Again, I was raised by a nurse and spend a lot of time addressing healthcare issues with kids that I have had that are in care, and have served on several boards within the community, including Aetna's Kentucky Sky. program, which serves children that are system involved, whether that's through the foster care system or through the juvenile justice system. So definitely have that kind of proximity and closeness to a lot of these issues coming from a lot of different angles, and hoping that will help support you all as well.
Thank you very much. We appreciate that. And I'll repeat this one more time, just for those of you who may forget what the question was by the time we get to you, but how do you plan to support the nurses in the 2023 session? Maria?
I always forget where that unmute button is. I think that expanding capacity and reinstituting the provisions that we all discovered were so helpful during COVID needs to be a big priority. We also need to support our SANE nurse examiners, because they are going to be a critical component. Last but not least, we need to take some steps to provide some safety for our nurses. The incidences of assaults and abuse have become much more commonplace, and they need to have legal support so that they can know that they will be safe at work. And those, I think, are the 3 high priorities. I do think having nurses in schools, though, is a terrific step.
Great, thank you. And Charles, would you answer the question, please?
Yes. Well, obviously, being a freshman representative, a big learning curve, learning more about the nursing profession, as well as how government is going to work to help you all. But the 3 things that come to mind, the first one is the nursing shortage. Many of the industries I would talk to, that is one of the biggest issues they have today, is just a shortage of people. So what can we do at the state level to help fill or bridge that gap of that 36% shortage that we have? The second thing would be, I'm a firm believer in the school nurses. Getting a nurse in each school would be critical to improving our school system, as well as the nursing industry in Kentucky. And then third would be nurse practitioners. And ended up with a nurse practitioner, and it was probably one of the best moves I've ever made.
Great, we appreciate that. Ken? You're on mute.
You're okay. I didn't start the timer
I thought
yet.
I was unmuted. Sorry about that. Don't take that away from my minute now.
I didn't.
Sorry, I get myself when I do that sometimes. But anyway, I've always approached your organization and any of your members with an open door policy. I'm always want to hear more about how we can provide a better delivery of services and so forth. So it's always open. I will not change my approach and work with you all. Like I said, I've sponsored quite a few bills in the past. I continue to do that. And in regards to the CAPA CS, I think that's really, really needed, because there are shortages everywhere in terms of healthcare providers. It gives you a whole lot more flexibility and increases access, significantly access, particularly when it comes to rural part of the area, because on the mental health side, it's a little bit worse, be honest with you, but we're trying to do what we can to increase accessibility. And this one particular aspect is definitely needed. I think your board is a model in the United States and how it's run and how you go through your regulations, your licensing. So I do applaud y'all for that. When it comes to workforce, I tell you what, that is significant. I came across and talking to Christopher 2X that he has future healers. And basically it starts with 5-year-olds up to like 13, 14-year-olds that basically partners with a healthcare provider. Now that's a long-term strategy. And I think it's a very good strategy in terms of trying to do that. And then parlay that is a short term, which you laid out in terms of try to fund the scholarships and so forth and forgiveness loans. So I support all that. And then last but not least, between the sexual assault, I totally agree with that. We deal with that a lot, mental health services, and then having nurses in school. So I try to put that as quickly as possible in 1.5 minutes. I see the ones up, so I'm dropping off.
Thank you, Ken.
Thank you. You got to be a quick talker with this group. Jared Bauman, you're next.
Thank you. Yes, I am also a big supporter of removing the CAPA CS requirement, and I certainly appreciate the way Dr. Welch explained that and early on here. something I didn't mention during my bio, but I identify and solve problems for a living, actually, in manufacturing. So I certainly appreciated the way you described the way you reach your decisions are based on research and data and facts. So I have a great appreciation for that, and I think that we can work together to ensure the best patient outcomes. I'm very aligned also with increasing access to the sexual assault nurse examiners. We've got an extraordinary crime problem here in Southwest Louisville and PRP and Valley Station, the district that I aim to serve. And I don't want to sound like I don't care about other aspects of victims, but ensuring the forensics aspect of prosecuting these criminals would be extraordinary for our communities. A big supporter of having nurses in every schools. And when it comes to the nursing shortage, I do know a lot of nurses, like most of us probably do. And I'm worried about retention right now, as well as, driving more people to nursing, because I think a lot of our nurses
Your time is up. Sorry.
It happens to the best of us. And last but not least in this round is Jenny Woolridge.
Yeah, so I'm all about education. So I've always been about education, learning for myself and for others. So with that said, I definitely support the CAPA CS bill. So with nurse practitioners, they're educated, they need to be able to practice to their full potential, need to be able to be able to practice to the extent that they're trained. We also need to make sure that we have nurses in our schools so that our children can be healthy at school. Sorry, I have a flag going around. Need to make sure that they're better, they get their healthy, they get their scores, they understand the learning disabilities. I know my son has a learning disability. A lot of people don't understand that. And we need somebody there to help understand that, what they're driving towards. And in addition to the education, we need to be able to fund the education for those nurses to increase the number of nurses that we have in the hospitals, in the offices. So I know we have the shortage. So how can we fund that so we get more nurses there, so we don't have that 36% shortage? So I know we have all these nurses because of that shortage that are getting burned out. How do we make sure that we don't get them burned out, that we don't have them working the overtime because of that shortage rate? So I want to make sure that we have that relationship with the KNA, and we're out there learning together.
We appreciate that. Thank you.
Thank you.
And I'll turn it back over to Dr. Welch for the next question.
Thank you, Julie. So our next question is the nursing crisis a priority to you? And if so, how do you plan on addressing this in this very short budgetary legislative session?
Who are you going to be starting with, Brittany?
We'll, I'll just start left to right at the top, and we'll start with Mr. Baumann.
Thank you again. So it is definitely a priority that our essential workers that we know nurses are adequately staffed. And so when it comes to ensuring that, I think I was going with retention before, because I think that a lot of our nurses are, at least the ones that I know, are burned out. And so I think, higher wages could definitely help keep some of those folks in the field. I don't really know all the ins and outs of the nursing industry. So I would definitely be a learner in this area to learn from the people that know firsthand what's most important to a nurse and what's driving them out of hospitals, of offices, of the industry. So that's definitely something that I'm open to learning and adjusting our approach for keeping nurses and also for bringing people into that field long term.
Ms. Wooldridge?
Yeah. So I know when I've talked to a lot of nurses, one thing that I've talked to them about is those school loans. I know when I talk about education, I hear so many nurse practitioners, they talk about the school loan, the debt they have to repay. So one thing that I would definitely be in conversations with is talking about that budgetary line item of how can we have that loan forgiveness of that coming in with the nurses, the nurse practitioners, is how can we make that a budgetary line item? And what does that look like? We talk about the wages, we talk about they have those wages, and that has to come out on the back end somewhere.
Thank you.
Mr. Fleming?
You're on mute, Ken. And I didn't count it against you, I promise.
There I go again. Sorry. I get, sorry about that. I'll just keep it unmuted to keep things simple. The work shortage, I think what Jenny mentioned is the forgiveness loans for the increasing debt that you have to go through nursing school and those sorts of things. So I think that might be a low hanging fruit that we might be able to tackle this coming session. When it comes to looking at increasing the budget, I know your priority or one of the things you mentioned about $100 million. That's a good chunk of change. Obviously, this is an off budget year that might be hard to push through, but we can set the groundwork in order to start looking at those types of incentives and programs to help bring on more nurses into the profession. So. The other thing I want to say it's a low hanging fruit, but I know it's going to be a little bit of a challenge is the CAPA and getting more accessibility in terms of that type of initiative. I really think accessibility is really important in terms of providing healthcare and so forth. So the workforce has always been it's a tough issue across the professions. In industry, and what do we do to help provide y'all assistance, the resources in order to get more people involved? And we need to start early, as I mentioned.
Thank you. Ms. Sorrells?
Thank you. One of the issues is not, I think, as much money, because of course, many nurses are making fine salaries, particularly in the traveling nurse profession, but we need people to be nurses who are wedded to our communities and know our communities. And a lot of the issues, I think, stem from quality of life issues, workplace environment issues. Those sorts of things also need to be addressed, and those can be addressed right off the bat as opposed to waiting for a budget year. We also need to make sure that although we're all in favor of school nurses, that we are actually making it possible for schools to afford to have those nurses, because we can pass all the requirements all day long, but if we don't provide the funding for them through the legislature, then it's a pointless additional burden on the schools that will not be met. So we need to address quality of life issues, work-home balance. Everybody is seeing that is becoming more and more of an issue, and you can't cure that with dollars alone. Thank you.
Ms. Stalker?
So some of those things have already been addressed, but something that hasn't been talked about that I want to also mention is something as simple as sign-on bonuses. So it looks like for something I was reading maybe a week or so ago, I know there's some programs that are being piloted in other states where that has been really effective as far as getting more nurses to come back to the professions, ones that have already left. I also think we need to pay really closely attention to our public education institutions. And so I am definitely in favor of having nurses in every school all day, every day, as somebody who has children who take medication there during those school hours. That is super critical. Just the other day, my daughter said, I didn't take my afternoon medication because the nurse wasn't there. It's like, oh, okay. Let's talk about what the game plan looks like for when that happens. So we need to look at some other opportunities. I know here in Jefferson County we have different tracks and magnets that our school district is trying to help jumpstart young people on a particular road that they might be interested. I think they refer to them as academies, and so some of those high schools might have a health and science academy and nursing program. So what if we could build on public education that way across the state, have these types of programs at the high school level to give young people just a taste of what that profession is like, and encourage them to continue that education moving forward.
Thank you. Mr. Breitenbach?
Yes, thank you. I think it's vital at the state level that we get creative in working with your association and coming up with new innovative ideas and policies to where we can help you retain existing nurses as well as recruit new nurses. Someone had mentioned earlier, I know several nurses that over the last year or so have embarked, they've left our community to go work in other states. Obviously, that is number one that I hear from everybody. I can't find employees. So we need to work harder to make sure we retain the good employees that we have here in the state, as well as attract new ones. And I believe the new ones, outside of filling the high percentage of openings that you have, would also come with the addition of adding a nurse in each school.
Very good. Mr. Nemes?
Yes, thank you. So I think this is a major problem we're having, obviously, with nurses. It's a major problem we have with teachers. We have it with factory workers. We have it with restaurant employees. It's a massive problem in Kentucky. George Bush used to ask presidents or prime ministers, what keeps you up at night? And so what keeps me up at night, if anything, is Kentucky's workforce participation rate. Almost half of our able-bodied working age people in Kentucky are not working. And so most of the things that we've done in the General Assembly over the last 6 years are designed toward getting those folks back to work, figuring out what they need. Do they need education? Do they need retraining? Whatever it is, get them back to work. I know Kim Mosier is meeting with a number of organizations to specifically address the nursing shortage. And so I'd like to, support her and the kinds of work that she and the other organizations have done. And then apprenticeships, but are something I think is important we can use in the nursing world as well. I also like a lot of what Ms. Stalker said and what some other people are saying, and I won't repeat those, but I'd like to associate myself with those comments as well. Massive issue, hugely problematic across the board in Kentucky. We got to get working age, able-bodied people, got to get them working.
Ms. Denton?
Great. Thank you very much. And the next question is, what would you like to see as a priority for the KNA? And I'm going to start with Jason Nemes because I know he needs to hop off at 7. So, Jason.
Thank you. Yeah, thank you. I just pulled into the fire station where my 7 o'clock meeting is. Thank you for letting me go first. Birthing centers. And the reason I say that, I think it's important for Kentucky, but also, that's a bill that I'm a primary sponsor of. And so I think, to allow pregnant women who want another option besides hospital or home birth to have their child, I think is something that we should support. I mean, the most important thing, obviously, is that Kappa CN or Kappa CS. But I do think I want to push you guys to support even more, because you already do the birthing center bill.
Thank you. We appreciate your participation and understand you've got to leave soon. Next, I'll go to Jared Bauman.
So I would like to see, I know I've mentioned it a couple of times, that the priority be retaining the nurses that we still have working, because if we start to lose those folks as well, then we're really going to be in a bad way. I've talked to a lot of nurses again, and some of the environments that they're working in are hostile with patients and doctors, and some of them are new nurses, and so they're maybe not making a lot of money yet. Maybe they're making $28 an hour. Where you can go to Target now and make 25. So, it's a pretty heavy schedule and heavy burden of stress and accountability on somebody that could very easily, just move into a different field for relatively similar pay. So I would definitely like to see workforce retention be a priority this year.
Thank you. Jenny?
Yeah, I think that, making sure that the nurse practitioners are able to practice, I think that's a huge one. And like I said earlier, as I see all of mine are nurse practitioners, including my surgeons. I see a nurse practitioner, and then I go to surgery, I see the surgeon and go back to see the nurse practitioner. And I agree with Jared. I think that the retention, I think across the board, we do have working bodies out there. Getting people working and then keeping them is huge. We've got to be able to get the working bodies there. Keeping working bodies there is a big thing.
Thank you. Sarah?
So I think it has to be retention and recruitment. Retention in the sense that we will lose someone's institutional knowledge, right? Because this happens in other professions. I see this this is also challenged within the educational setting as well as in social workers, right? Like you have all these very experienced people and they get burnout because they're not getting the pay, they're not getting the physical and mental protections that they need for their own health. They're experiencing racism. They're burnt out, and to the point that was made earlier, it's like, is this worth it? Could I literally be going to stock shelves someplace at Target for $25 an hour and have a lot less stress in my life? So, but we got to be able to walk and chew gum at the same time. So we also have to be looking about how do we create that pipeline and make sure that we can bring in that next round of folks and generations of people to come and not start them off with the same sort of struggles that so many of our nurses for all of forever have always had to deal with.
Thank you very much. Charles?
Yes, I'm going to agree with everybody so far on the retention. I believe that's vital, as well as I'm going to go back to my own personal experiences and what can we do to help nurses take that next step and become a nurse practitioner. Like I said, I went through it about 5 years ago, had several medical issues I was dealing with. I lost my doctor right in the middle of it, found myself with a nurse practitioner, and I'd like to help that cause and help those nurses that are looking to take that next step and get into being a practitioner.
Thank you. Maria?
I'd like to see the KNA educate legislators about the things that they need, because that's really where the gap is. You are the experts, and we need to be listening to you about how we create a workplace where nurses want to work and where people want to become nurses, so that they have the independence and autonomy to exercise their medical judgment, which is very vast.
Thank you. Ken?
Thanks, Julie. I mean, I don't disagree. With Maria mentioned that we're here to hear what your priorities are and what you are trying to accomplish. And I look at this as you're my client, and I need to serve you in order to make sure your life is better and have a quality of life as much as possible. So I would really defer to you all in terms of prioritizing your goals and objectives. I would suspect that the work shortage is vitally important, and try to look at any and all avenues and going down that process. And then the CAPA, I think I imagine that's probably very important to you all, because I've heard that time in time out for many years that we need to go ahead and take care of that particular issue. So I'm going to look to you all to guide me, and whatever there is, obviously it depends on the language that was written. But generally speaking, and I feel pretty confident that we get something going in terms of your high priorities, we'll make it happen in terms of getting things passed. So I'd like to hear from you all what your priorities are, and then support you whatever measure that we have and give you the resources to make this happen.
All right. Thank you very much. We're doing several of these regionally around the state. And this is the first time there haven't been questions from the audience, because you all did such a great job of answering the questions we had. You answered all the questions anybody might have even had. So I'm going to turn it over to Delanor.
Wow, this is really exciting. I cannot tell you how much I really appreciate you all being here with us and talking with us. And so many of you have said things that we really want to do, which is, since we represent and support 89,000 nurses, we would love the opportunity to be a resource for you. We would love for you to email me or pick up the phone and let us get you an expert in any area where you would like to support healthcare, nurses, nursing. And so I say, please include us in your plan for solutions. I'm going to turn it over. Well, there is one comment in the Q&A, and this is from Dr. Hager, and it says, just want to make sure that everyone knows that the school nurses curriculum includes assessment and recognition of a child that may be depressed, anxious, bullied. So the whole child would be their focus area, working towards healthy eating, exercise, physical and mental health. And thank you for giving us your time. Thank you, Dr. Hager. And I have another comment from Dr. Baran who says, exactly. So whatever you guys were saying, she's going with exactly. So, Dr. Welch, did you have any other questions? Oh, there's a question here from Sarah. How does KNA expect Amendment 2 on the ballot to impact the nursing profession if Kentucky becomes a state where abortion healthcare becomes illegal? I'm going to take that on just briefly, and then Dr. Welch, it gives you a couple seconds for you to formulate your thoughts. Our process is, as Dr. Welch mentioned earlier, if you have an issue or a legislative discussion that you would like to have, we have on our website in the area that it says advocacy. If you will complete that, and if you have an opinion about what we should do, then that will go to the GA cabinet. The GA cabinet will do the research, and then they will make a recommendation to the board. And whatever the board decides, because they represent every single nurse in the state, that will become a priority in how we will manage that for all of the nurses in the state. Dr. Welch, did you have a response that you would like to make to that?
No, I think you put it, I would just like to supplement, if I may, that KNA is a bipartisan or nonpartisan organization. So we simply look at issues or topics and the impact to patients and nurses based on their merit. We've always kind of conducted business based on the research, the data, facts, and statistics. And it's been kind of our guiding star. So if this is a topic that any of our nurses, any of our legislators, anybody throughout Kentucky would like to have nursing input, then I would encourage them to follow that standard process, go to our website, so we can do the necessary research and make a recommendation. The Governmental Affairs Cabinet can make a recommendation to the board, and the board can take an official stance.
I have to admit, I'm extremely proud of the Kentucky Nurses Association that we stay focused, as Dr. Welch said, on the issues. We are definitely a nonpartisan organization, even though, do we have any Democrats who are running on this panel tonight? Yeah. One? Okay, great. Well,
I'm a Democrat.
Okay, well, that's wonderful. But, and the only reason I say it's wonderful is that we want to hear from everybody. We really, really do. We care what you think, and we want you to care what we think. And we don't want anyone to think that we only listen to Republicans or we only listen to Democrats. We listen to people who want to help nurses, nursing, healthcare, and patients. President Metter, is there anything that you would like to interject before we call it a night?
Yeah, I'll just add quickly to that, across the nation, nurses involved in women's health have been very vocal and concerned about that, about abortion becoming completely illegal, especially in cases where the mother's health is at risk and for the pregnancy is at risk or is impacting the mother's health. So I think that if that were to happen, it would be interesting to see, and I think that would impact nurses in our state. So that's probably one of the things that our GA cabinet will be talking about retreat, because that's another one of the things that, is another hot topic. And that's all really I have to add about that. I really thank you all so much for being here tonight. It's been very great to hear your support for us. And it's been a great opportunity for us to tell you about what we think is important, and obviously vice versa. And we appreciate those of you who have historically represented our needs and our causes, and I really appreciated hearing the strong support for removal of the Kappa CS. That, like Dr. Welch said, the number one thing we believe that would impact is access to care across the state. And that's not, it's mental health too. There are a lot of those medications that would not require a collaborative agreement, that are not just talking about narcotic type things. We're talking about other medications. So very good. If there's no other, I don't see any other questions in the chat box or Q&A.
No.
So Delano,
Yes.
ready to
Two
wrap
things.
up?
Yes, two things. One is, Mr. Fleming, if you'll send me your information for that nurse practitioner in mental health, I might be able to provide you with an avenue to get you some support. Also, just wanted to mention that we have 2 more town halls that we will be doing next Thursday and then the Thursday after that. So on September the 22nd, our town hall will be sponsored by Penny Ryle, Western, and the Green River Kentucky Nurses Association chapters. And then on September the 29th, which will be our last one, it will be Nightingale chapter. And please feel free to attend any of these other town halls as an attendee. We want to make sure that we give opportunity for other candidates to be panelists, but feel free to join in and ask questions even from the attendee realm. And with that, President Metter.
Thank you all very much.
And thank you all.
Thank you all.
Thank you for the
Guys,
opportunity.
thank you.
Thank you.
Thank you for the opportunity.
Thank you so
Bye.
much. Have a good evening.
Good night.
Good night.